medical gross anatomy first lecture. I'm going to go from slides 1 to 32 first. Let's first look at some of the basic terminology. Let's learn it before we dive into more complicated concepts. The first terms that we should know is joints. So joints are areas where adjacent bones interact, and they also are called articulations. All joints are a compromise between stability and flexibility. So what does this mean? So a very stable joint will not be as flexible as a less stable joint, and vice versa. So an example includes the hip joint or the acebabulofemoral joints, or shoulder joints, acromioclavicular joints. They have limited flexibility, therefore they are not stable, and we see a lot of cases of dislocations at these joints, whereas the pubic symphysis joints and the sacroiliac joints is very stable. Therefore, they are not flexible and with virtually no range of motions at all. The next term that we want to discuss is muscles. So muscles is a contractile organs composed of muscle tissues, blood vessels, nerves, and lymphatic vessels. We have to understand that what muscles does not they do not contain only just muscle tissues. It needs blood supplies from the blood vessels that supplies it with blood and oxygens. It needs nerves to innervate it, to stimulate its actions, and it needs lymphatic vessels to drain its waste. The next term is tendons. So basically, tendons is used to attach the muscles to bones. So it is a flexible but inelastic core of strong fibrous collagens tissue attaching a muscles to a bone. An example of this would be a quadriceps tendon, semitendinous tendon. The fourth term is ligaments. So what is ligaments? Ligaments are used to attach bone to bone. So it's a dense band of connective tissue fibers that attach one bone to another. So now let's look at some of the joints that was discussed in the lecture. The first one that were talked about was the sacroiliac joints. It is formed by the sacrum and the ilium. The sacrum's right here and the ilium's right here, and this is the pelvic bone. The pelvic bones is formed by three different bones that are fused together. They are the ilium, the ischium, and the pubic. The ilium's right here, the ischium, the pubic bones, and that's formed the pelvic bone. And this is the sacrum, so the joints that attach both of them are right here, the sacroiliac joints. And this joint is reinforced by the sacroiliac ligaments right here. And this joint is very stable with virtually no movements. The next joints that we want to talk about is that were talked about in the lecture was the hip joint, or the acebabulofemoral joints. So this joint is formed by four bones, like we discussed earlier. So the pelvic bone here, it formed the acetabulum right here, fused together at this area. It has the ilium, the ischium, the pubic, and there's the femur. The femur head will attach to this area right here. So this joint is stable with limited flexibility. It is a ball and socket joint. The ligaments that is used to reinforce this joint are the capsular ligaments. So the capsular ligaments will cover this whole joint right here. It's a capsule of the joints. It will cover this joint, and there's an extra capsule ligaments. These ligaments are a little, I would say, outside of the capsule ligaments. That's why it's called extra capsular. And these ligaments, they originate from one of the three bones of the pelvic bones, and they attaches to the femur. That's why we see three different names, and it all ends with the femoral. So the first one is the femoral. So that ligament originates from the ilium, and it attaches to the femur. And the next one is the ischiofemoral ligaments. That ligament originates from the ischium and attaches to the femur. The last one is the pubofemoral ligament, originate from the pubis and attach to the femur. And all three of these extracapsular ligaments will prevent the excessive internal rotations of the hip. And however, only the iliofemoral ligaments prevent excessive adductions of the joints right here. Because if we think about it, if it starts from the ilium, and the ilium's right here, and it attaches to the femur right here, attaches the femur from the ilium is superior to it, and if it attaches to the femur right here, so when you adduct, when you adduct right here, this will try to prevent the adductions, because it attached from up here to here. The second one, or the third one right here, the pubofemoral ligaments, is the one that prevents excessive abductions. So if you see the pubofemoral joints, it's down here, and it attaches to the femur dislocations. So if you're trying to abduct the femur, then that would try to prevent it. It would try to adduct the femur to this directions right here. The next ligaments that we look at was the intracapsular ligaments. So this ligaments, this is the ligaments of the femoral head that's within the capsule. It's a very small and weak ligaments, and it also carries a small branch of the obturator artery to the femoral head. One of the slides was talking about the palpable anatomy. So those structures that can be that you can feel if the on the body of the donor, if they are thin enough. Those landmarks of the gluteal regions include the ischial tuberosity, the iliac crest, the pubic tubercle, the anterior superior iliac spine, and the posterior superior iliac spine. I guess one of the last slides was, I guess, like around 30 or 31. We talked about the gluteal muscles. Gluteal muscles, the three big ones that we want to talk about right here are the gluteus maximus. All of them will end in the gluteus. So we have the gluteus maximus, largest muscles right there, gluteus medius, and gluteus minimus. So gluteus maximus is the hip extensors, and it's innervated by the inferior gluteal nerve. Gluteus medius and gluteus minimus are the hip abductor, and they are innervated by the superior gluteal nerve. The 6 lateral rotator hip muscles that we need to know about are the piriformis, the gemellus. We have the gemellus superior, gemellus inferior, and the obturator. We have obturator externus and obturator internus. The last one is the quadratus femoris muscle.